Jazzcast Pros.
Welcome to the Healthy Illness Podcast. This is a special episode of Healthy Illness. We are talking about our health, what it is, how it works, what makes us healthy, why we get sick, how to increase our health, and how to limit our risk factors for chronic disease. This is episode 2. In our first episode, we talked about what health is, what mental and physical health is comprised of. It's more than just our health behaviors. We talked about the social determinants of health, those 6 focus areas within the determinants or drivers of health that play into our health as human beings. Just as a recap, those areas of health, in addition to our health behaviors, so remember, our health behaviors are about 20 to 30% of our health. The rest of our health is made up of these determinants or these drivers of health, which are kind of outside of our control, but not really outside of our control. And we're going to talk about that in just a minute. But the social drivers, social determinants of health are economic stability, so our jobs, poverty, transportation, debt, our neighborhoods and built environment, where we live, like our actual zip codes and geography, affordable and quality housing, walkable sidewalks, homes without things like lead in them, safe communities, and the healthcare system. So, access to healthcare, access to doctors and hospitals, but also access to quality care. Not only are there doctors and nurses and technicians, but are they good at what they do, right? Language access, so inclusive of the language that people read and speak. Also, health literacy. Do we understand the technical terms that these medical folks are using? Digital literacy, being able to navigate computers and smartphones to be able to make appointments and learn about our health, and things like financial literacy, like understanding the impact of health and our finances and debt and all of that stuff. Social and community contacts, so our village, our community, our families, our friends, inclusive of things like relationships with the criminal justice system, our social supports, community development, racism, oppression. These are all a part of the social and community context bucket of our drivers. And then finally, education. So, the type of education we get, is it good education? The types of high schooling and formal education, being able to leverage our lived experience to better understand ourselves and our community, having access to vocational training, all of that kind of stuff falls under this very broad title of education. So we have those drivers of health, and they impact our health in many ways. And so when it comes to our health behaviors, and that's what we're really going to talk about today, our health behaviors and what we can do to be healthier, how we can kind of stave off and prevent chronic disease from creeping, into our families and into our lives. And when it does, to minimize that impact on ourselves and on our families by kind of doing some things to stay healthier before getting sick and to live a healthier life, even with an illness. So, when we look at risk factors, and that's kind of where we left off in our first episode together, our risk factors are those drivers of health, but within our own sphere, our own areas of being able to make decisions, our own health behaviors. There are 4 primary risk factors or buckets of, no, we'll just call them risk factors, 4 risk factors to prevent chronic disease. And so remember, we talked about acute disease in acute illness or chronic disease in chronic illness. And chronic diseases are those long term conditions and diseases that didn't just happen overnight. Right. It took a while to get to that place of having this chronic disease for the most part. And then an acute disease or acute illness is something that happens, kind of it just happens. Either you are exposed to something like a cold or flu virus, or there may be a physical issue. Maybe you slip and fall and you break a bone. That's an acute situation, quick onset, and there is a kind of prescribed amount of time that you'll be sick with this acute situation. And that is not true for a chronic disease. So, these four main risk factors for preventable chronic disease are tobacco use, nutrition, physical activity, and alcohol use. There are several leading causes of death in the US that also relate to these four risk factors. And those are heart disease or stroke, cancer, accidents like car accidents, falls, things like that, lower respiratory diseases, so chronic lower respiratory diseases, Alzheimer's, and diabetes. Then just a few years ago, which makes sense, right? COVID-19 was added as a leading cause of death among US adults. So, what are some ways when you think about this list of risk factors and the leading causes of death in the US? What are some things that we can do to prevent being in this position, right? So, how can we stave off high blood pressure, diabetes, so that you're older when you get it? And even better, how do you not get it in the first place? So, again, not just diabetes, but we're talking about heart disease, or stroke. Again, one in four deaths in the US is related to heart disease or stroke. Cancer, one in five deaths is related to cancer. When you think about, well, what can I do in order to not be in this position? How can I lower my risk factors? There are a handful of things. And I feel like, you probably know them, but I'm going to tell you anyways. First thing, I know you've already said it, right? Stop smoking, right? Decrease your smoking, right? So even if smoking is a health behavior that you choose, smoking less is a whole lot better than smoking more, right? Like that, I'm keeping it basic, keeping it plain. That's where we are, right? Eating more fruits and vegetables, eating whole grains, making better health decisions around the food that we eat. And so we talked in the first episode about access to fresh fruits and vegetables. And if you don't have access, then what are your options? Well, if your options are to eat canned vegetables, there are things you can do like rinse off your canned vegetables to remove a lot of the extra added salt from that's added in the production. Like that's how they make sure that those cans last forever on your shelves. But if you rinse your vegetables, you've just made them healthier. Is it the best choice? No. But if that's the choice that you have, you can make that choice better for you and for your body by rinsing them. If you are in a position to maybe buy some healthier options, you can buy frozen over canned, right? So it doesn't have to be, let me go straight to the organic food section and buy this one apple because that's all I can get based upon the price, or I can get, three cans of something, right? No matter what decision is before you, we can make that decision better for the body by implementing, a couple things like rinsing your vegetables. So, eating more fruits and vegetables and whole grains, making that choice and making the best choice within that grouping, right? Limiting your intake of salt. I just talked about that. Added sugar. Learning how to read the labels on the packages of food, looking at the ingredients and seeing what's in there. If one of the first four items is salt or sugar, you want to try something else, right? Limit alcohol use. Try and get regular exercise. And what does that mean? It doesn't mean go out and get a gym membership. It doesn't mean you got to get up at 5 o'clock in the morning and start, doing your calisthenics in the living room. It could be you take the stairs instead of the elevator. You park farther away from the door. You get up and stretch and take a walk on that 15-minute break. It doesn't have to be a walk far. Maybe you're just walking around the building, right? Keeping physically active, keeping moving. We hear these things like get regular exercise. And where do you fit that into your schedule, right? I'm sure you have a lot going on. But there are ways, like I just mentioned, to be able to get bits and pieces into your day to make your body healthier. Maintaining a healthy weight, big is so let me just say that is the rule, right? Like that is the suggestion, maintaining a healthy weight. But I'm going to challenge you in that if you focus on your movement and your food intake, drinking your water, right, making better health decisions within your ability to make health decisions, right, that will have a great impact on your health outcomes. Getting into a primary care provider and getting those baseline tests, your blood pressure, your blood sugar, your cholesterol checked, knowing what your numbers are is so vitally important to knowing how healthy you are. It's a little tough to know if your blood pressure is higher than usual if we don't know what usual is. So, making an appointment, getting in there, taking the time out, which I understand can be difficult. We talked about that, right? With the social determinants of health, transportation, jobs, insurance access. Listen, I understand. And with what you have left after all of that, right? Take advantage as much as possible of every opportunity to get in and see your healthcare provider. Push your way through. Um, and so this is a message to the everyday person, right? Not the healthcare system. Like the healthcare system needs to fix itself. Like they need to get in there and figure it out. In the meantime, we're out here living and we need to make and know how to make better decisions based upon the options that we have in front of us. So check in with the healthcare provider if you have one. If you don't have one, connect with the healthcare provider to get those baseline numbers, to get your annual physicals in so that you know how you can make better choices for yourself. Then, if you are given a prescription for chronic disease like high blood pressure or high cholesterol or glucose, blood sugar levels, right? Take the medication that they've prescribed. Take it the way it's supposed to be taken. And then if it's not working, let the doctor know it's not working. Give them a call. If you are taking your medication and you don't like the side effects, right? Don't just stop taking it. Call the doctor. Let them know what's happening. And perhaps they can give you a different medication. Because what happens is when you go back for your checkup, and they run all your numbers and they see nothing's changing, they may increase your dosage because they're thinking that the medication's not working. It's not that the medication's not working, is that you had a problem with the medication and the medication isn't in your system for it to work, right? So the more open you are with your providers and let them know what's happening, let them know what's going on, the more they can work to assist you in making better health decisions. You are your best advocate. And so I want to give you some information, give you some places to call if you're looking for ways to stop smoking or reduce your smoking. New York State has the New York State Smokers Quit line. You can give them a call at 1-866 New York Quits or 1-866-697-8487. That's 1-866-697-8487. Or you can go to NY, like New York, nysmokefree.com. They've got patches, they've got gum, they've got plans to help you reduce your smoking. Um, if you are looking for ways to increase your food intake, like not necessarily increase your food intake, but increase your intake of healthier foods, right? What does that look like? So I talked a little bit about more fruits and vegetables, eating those whole grains, making the best decision for your budget and doing the best with what you have. And so, as we look at these healthier decisions, eating more fruits and vegetables, reading the labels, understanding what's on those food labels, selecting foods with lower salt and sodium, lower saturated fats, trans fats, less or no added sugars, and making those healthier decisions within your space, within your ability, capabilities, are all some of the ways in which you can lower those risk factors. So, in addition to the risk factor piece of it, there are actual steps you can take, like being the captain of your own healthcare team, right? That you can take to live a healthier life. And so, again, these are not just health behaviors, but it's using some of the spaces within that, the social drivers and social determinants of health to make better health decisions. In the first episode together, I talked about a healthcare plan and what that looks like. And it's not scary. It's not a big long process. What it is agreeing, understanding, knowing, accepting that you are the pilot, right? You are the driver of the car. You are the captain, or not even the captain or the coach. You are the owner of the team, right? Like you make the decisions. You are your biggest advocate. And so I'm going to give you 10 actions you can take in order to build this health plan for yourself, in order to create a community and an environment of caring, and in order to take this action plan, this health plan to the next level. So, I'm going to give you 10 actions that you can take right now in order to be a healthier you for you and for your family and community. First thing, I will make an appointment with a healthcare provider. So, do you have a primary care doctor? If you do, have you seen them in the last year? Or do you have something going on and you should probably see them because you got something going on? Right. If you have a primary care physician, make your annual appointment. If you don't have a primary care physician, your first action is to find a doctor. Connect with a primary care physician so you can begin getting those baselines, so that you can begin building a relationship with someone who will learn to know you and have intimate knowledge of your health status, your health conditions, and the determinants that affect your health. Number two, I will research and share reliable information with my network of friends and family. That falls under our health literacy, our digital literacy determinant of health. There's so much information out there. We have to take the time and make sure that the information that we're reading, that the information that we're sharing is good and reliable information. I will look for ways to incorporate activity into my daily life. We talked about this one, right? It doesn't have to be join a gym. It doesn't have to be go walk the neighborhood for 2 miles or 20 minutes. It can be I'm going to get off the bus a stop before I normally get off the bus, or I'm going to take the stairs when I park, or take the stairs in the building instead of taking the elevator or escalator. Number three, I will support my family, friends, and coworkers in their efforts to make healthier choices. They don't want to eat cake, don't make them eat cake. You want to kind of, be the change you want to see. You want someone to be supportive of you and your health decisions. Model that behavior, right? And Help your family, friends, and coworkers in supporting them and making healthier choices that they deem are important for their lives. Next one, I will promote healthy behaviors in my network by modeling them. That, if you look at these other options, the healthcare provider, other items, calling and making an appointment with a doctor, researching and sharing reliable information, incorporating activities in your life, supporting family, friends, and coworkers. These are all ways of modeling and promoting healthy behaviors, right? So that was number 5, promoting healthy behaviors in your network by modeling them. Number 6, I will encourage others to maintain their healthy habits, right? That goes back to supporting. It goes back to modeling. You're teaching other people how to help you maintain your healthy habits by encouraging them to maintain their healthy habits. Takes a village, right? I will look for ways to help motivate positive health choices in my network of family and friends. So understanding those determinants of health, right? Understanding that, things aren't, we know they're not easy, but understanding why they're not and ways to go about navigating the system, navigating transportation, navigating education, navigating community and environment, navigating the healthcare system, right? Just motivating others, staying positive, and helping them to make their own, because these are their health decisions, their healthy habits, right? Their health choices. So not forcing them, not making them feel bad because they don't do what you want them to do, but supporting them and helping them in the decisions that they've made for their health, right? So look for ways to help motivate positive health choices in your network of family and friends. Number 8, I will look for ways to ease stress and stressors that would lead to unhealthy choices. One of the reasons why a lot of folks smoke is because it helps relieve stress that they feel like, right? So, what are some healthier decisions? What are some ways to eliminate stress that could lead to unhealthy choices, right? So, look for those ways. Can't get rid of all the stress, but what are some things, what are some ways you can function and move? Maybe it's motivation, maybe it's meditation and mindfulness, maybe it's exercising, maybe it's eating healthier, right? These are all ways to ease stress. And when you're easing your stress, you're less likely to make unhealthy choices. Number 9, I will remind my family that change takes time. What? Yes. We did not get here overnight. We're not going to get out of here overnight. Change takes time. Baby steps. Focus on the health component. Focus on getting up from the fall, right? Like we're all going to fall. We're all going to make a mistake. We're all going to not get it right. But instead of focusing on the fall, on the mistake, acknowledge it, understand that it happened, look for ways to avoid it in the future, right? And remember, it takes time. It's okay. Change takes time. And number 10, offer to help friends and neighbors access healthcare and the healthcare system. What you learn, share with others. Someone looking for a doctor? Well, you just went through the process of finding your own primary care physician. Now you can help somebody else do the same. Do you need to go for a mammogram or get a colonoscopy? Right? What was that process like? Have these conversations. None of us are alone. I mean, people are out. We out here getting these tests, but we don't talk about them. Talk about your mammograms, talk about your colonoscopies, talk about, going to get a MRI or getting x-rays, right? It takes the pressure off of those who are afraid, right? It takes the wonder and the fear out of it. If we're all talking about it, we're all getting it done, even if it's something that's uncomfortable. So, mammogram, not comfortable, let me tell you. But Black women die more frequently, even though they are less likely to have breast cancer. for many reasons. We wait too long to get a mammogram. We don't go in right away once a test comes back. Like there are a lot of reasons why that is, but a lot of it starts with early testing. So making those decisions and helping other people make those decisions. Help them, give them the information. Let's change the conversation around health and wellness. So I want to leave you with this last takeaway. When you look at chronic disease and you look at acute health conditions, the state of health in our communities and our families, right? When we consider the determinants of health and the amount of our personal health choices are determined by the determinants of health, there is a way that we can increase community and connection and make sure that we all have someone to turn to, right? And I'm not talking about, in a crisis. I'm just talking about generally creating an environment where we have someone to turn and talk to. And that's creating the circle of care. So look at your friends and family, look at the folks that may not have children or a spouse or siblings that you care about. Do they have the supports around them that they need in order to be healthier? Do you have the supports around you? Do you have the people to call? They don't have to be your family. It could be your friends, right? It could be a mentor, right? It doesn't have to be who someone else's circle of care is made up of. But you want to make sure they know and ask them, would they be a part of your circle of care? And ask them, would you like for me to be a part of yours? And begin trading information, right? Talk about the doctors, talk about testing, find out what their needs are. Like, do they have allergies? Do they have medical conditions? If something happens, like who is their emergency contact? So if an emergency occurs, or if they just need someone to turn to, or could be anything, right? You've already done the work to create a system and create a circle of care that will help you help those you care about and will help those you care about help you. So thank you so much for your time. I hope this episode was helpful to you in understanding and bettering your health. And if you're looking for more information, check the show notes. You will see some links in there for you to get info on New York State resources and services. The New York State Quit line is 1-866-697-8487, or NY, like New York, nysmokefree.com. Other information can be found on the New York State Department of Health website. If you have a question, ask. Get that circle of care in place and begin to utilize those connections to help you be a healthier you for you and for those that you love. So until the next time, thank you and